of the greatest challenges facing public health in this country today is obesity. It's increasing at an alarming rate. In fact, estimates are that 2 out of every 3 Americans are overweight or even obese. Those who are already considered obese and have pretty much run out of other options may be weighing a more radical approach, a kind of surgery that's gaining in popularity. Healthbeat's Kathy Druzek went to Methodist Hospital to find out more.
Life was rough. I was 384 pounds. I was scared. I knew it was time to do something.
After years of struggling to lose weight on his own, Derek Brothers, an MTA motorman, decided on a weight loss operation. In June 2007, at the New York Methodist Hospital, he underwent a gastric bypass, the most popular type of weight loss surgery in the United States. So far, he's lost 162 pounds.
I got a second chance at life. I exercise now like as if I'm 25 years old. My eating has changed to the point where food is no longer the important part of my day. It's focused around life now. All the crunches, all the sit-ups, everything.
Derek is one of a growing number of Americans seeking to leave obesity behind through surgery. Last year, according to the American Center for Metabolic and Bariatric Surgery, more than 200,000 people had the weight loss operation known as bariatric surgery in the U.S. Dr. Piotr Gorecki has performed over 800 bariatric procedures at Methodist Hospital since 2001, an average of about 130 a year.
The principle is that the volume of the stomach gets somehow reduced. In case of gastric bypass, that's physical division of the stomach, making it very small pouch, which is really the size of the golf ball or the ping pong ball. And that really makes a patient able to consume only a very small amount of food.
A lot of people are under the misconception that they're going to be eating like a bird for the rest of their lives. In the first couple of months, you do eat like that. But about 6 or 7 months, your stomach does stretch and you're able to eat a little bit more.
Patients who choose gastric bypass shed 70 to 80% of excess weight, while patients who choose less invasive lap band surgery lose 40 to 50% of weight in 1 year.
And we are 222 pounds. The lap band surgery does not involve cutting of the stomach or the intestines itself. The lap band is made out of prosthetic material, a silicone, so it is restricting the amount of food patients consumes. This operation tends to be a little easier technically, with a little quicker recovery, less initial risk factors, because simply we don't cut any stomach or we don't cut intestines.
According to a report released by the federal government, complications from the bariatric surgery affect up to 40% of patients. They include bleeding, leaks in the digestive tracts, infections, hernias, blood clots, calcium deficiency, malnourishment, vomiting from eating more than the stomach pouch can hold, and many more. There is also a 2% mortality rate among bariatric surgery patients.
I had my surgery July 14th, and I started adding food, and I was doing fine. And then at the end of August, I started throwing up, nothing profuse.
Ann Gordon is an elementary school teacher, and she says obesity runs in her family. She had gastric bypass surgery, but her intestine healed too fast. It constricted the passage of solid food. She had 2 endoscopies to clear the problem, but she says she doesn't regret doing the surgery.
I feel amazing. I never had pain.
Patients must meet certain criteria to undergo bariatric surgery. They need to have a body mass index of at least 35 with comorbidities like diabetes and hypertension, or have a BMI of 40 without the comorbidities.
Patients must have some sort of documentation of failure to lose weight. We'd like to determine some mental stability and realistic expectations, and also commitments to follow-up, because both operations require lifetime follow-up.
Dr. Gorecki says weight loss surgery is no miracle cure. It's a tool for those who are ready to change their eating and exercise habits. It requires adherence to a strict program before and after the surgery.
Well, it is very important that patients do follow certain diet. Because of reducing the volume of food, that food is of a better quality, primarily focusing on the protein meals. meat sources, fish, chicken. So congratulate them.
Thank you, doctor.
On that numbers. They are quite impressive.
Thank you.
It is absolutely necessary that people do take supplements in the form of extra vitamins and minerals and irons and calcium, because they can get deficient.
You have to follow directions to the nth degree. Everything was measured and it was timed. Now, 8 months after, I'm eating almost the same things, obviously teeny tiny portions. And I could have a bowl of farina and I feel like I ate a turkey dinner.
Anne suffered from diabetes prior to the surgery, but now her sugar is at an all-time low and she's off her diabetes medication. A study published in the March 2009 issue of the American Journal of Medicine shows that bariatric surgery can resolve or improve diabetes in patients who receive the surgery.
The first time I walked into Dr. Gorecki's office, I was 341 pounds. I weighed 243 pounds.
He was a nice guy, but I never want to be this guy again.
Reporting for Healthbeat Brooklyn, this is Kathy Jadruzek.
I'll be 52 in November, and I feel better than I felt in 20-some-odd years.
By the way, assuming a patient meets the requirements for surgery, gastric bypass is covered by many private insurance plans as well as Medicaid. That's all for this month. If you want to watch past episodes of the show, go to brickonline.org/BIT and then click on Healthbeat Brooklyn. On our website, you'll find links to the programs and hospitals we've just featured. But right now, that information is also about to appear on your TV screen. Thanks for watching and stay healthy.